Testing, testing. Good, thank you.
Test, test.
Yes, testing, testing.
Testing 1 2 3 1 2 3. Testing, testing, testing. Testing, testing, testing.
Good afternoon. I'm at-large Councilmember Christina Henderson, Chairperson of the Committee on Health. Today is Wednesday, April 12th, 2023. The time is now 12:12. Today we are live and in person in Council Room 412 and broadcasting via the Zoom internet platform on cable channel 13, as well as on my YouTube page at CMC Henderson. I'm calling to order this meeting of the Committee on Health, which is the second part of two hearings for the proposed FY 2024 budget for the Department of Health. On Monday of this week, we held a hearing for public witnesses, and today we will hear from Sharon Lewis, Interim Director of the Department of Health. The Department of Health provides programs and services with the ultimate goal of reducing the burden of disease and improving opportunities for health and well-being for all district residents and visitors. DC Health does this through a number of mechanisms that center around prevention, promotion of health, expanding access to healthcare, and increasing health equity. With almost 750 FTEs, DC Health is organized into 7 administrations and offices, and we'll get into more of those today. But I will say notably, the FY 24 proposed budget would add an 8th administration to DC Health, the Public Health Laboratory, being transferred from the Department of Forensic Sciences to DC Health. On Monday, we heard from nearly 80 public witnesses who testified in support of sustained and increased investment in maternal and infant health, healthy food access, sexual health education, domestic violence prevention, and more. We'll reference the public testimony as well as the agency's budget chapter and pre-hearing written responses to the committee during today's questions. I don't see any of my colleagues in the Zoom, but I'm sure many of them will join. But before you begin, Dr. Lewis, as customary with the council, I ask that you and anyone on your team who might speak today, so that would be all of y'all, to swear under oath. So if you could just raise your right hand. Do you swear or affirm under penalty of law that the testimony you're about to provide to the Council of the District of Columbia and this committee is the truth, the whole truth, and nothing but the truth? Okay, great. Oh, okay. We have been joined by Councilmember Gray. So we'll give him a chance for opening statement. Councilmember Gray?
Very much, Madam Chair. I appreciate that, and we'll look forward to the testimony that's going to be provided by the witnesses. And we'll look forward to whatever questions we may have.
Wonderful. Thank you. Dr. Lewis, whenever you're ready. If you could turn on your mic.
Good afternoon, Chairwoman Henderson, members of the Committee on Health and staff. My name is Dr. Sharon Lewis, Interim Director of the District of Columbia Department of Health, or DC Health. I am pleased to offer testimony before you today on Mayor Bowser's fiscal year 2024, FY24, proposed budget and financial plan entitled A Fair Shot. I am joined today by DC Health's Chief Operating Officer, Mr. Keith Fletcher, our agency fiscal officer, Ms. Adrena Dean, and members of the executive leadership team, all of whom worked diligently to contribute to the formulation of the agency's budget proposal for the mayor's consideration. While Mayor Bowser's proposed budget continues to support district residents and businesses' recovery from the pandemic and make new investments in the future, the financial outlook does require us to make some tough choices. This budget reflects those financial realities while still ensuring that we are giving more Washingtonians a fair shot by investing in a safer, stronger, healthier, and more equitable DC. As Mayor Bowser has noted, this is the first year since 2009 that the district's revenue has decreased. Deputy Mayor Turnage shared during his testimony last week that the Health and Human Services Cluster's $6.29 million funding for fiscal year 24 represents a 32% decrease in the operating budget from last year. While 5% of that funding goes to DC Health, the other 95% is also geared towards improving population health and funding critical health services. The proposed expenditures within both the HHS cluster and other agency clusters will leverage the social determinants of health to align with DC Health's investments and improve population health. DC Health's total operating budget is $8.1 million higher than last year and will allow us to continue providing the services that residents, workers, and visitors need while modernizing our infrastructure and policies. Additionally, DC Health's capacity is strengthened through an increase of 33 full-time equivalents. These resources will drive our new and expanded activities in chronic disease prevention, IT modernization, and strategic partnerships with community-based organizations and other federal, state, and local partners to drive improvements to the district's public health systems. DC Health's mission is to promote health, wellness, and equity across the district and protect the safety of residents, visitors, and those doing business in our nation's capital. To achieve that mission, we use the Public Health 3.0 modern framework to improve population health and address the social determinants of health. The proposed fiscal year 24 budget advances the 5 key components of Public Health 3.0 by providing flexible and sustainable funding to leverage partnerships through our grant making, expand our infrastructure to do better address emerging public health threats, invest in our workforce as we emerge from the pandemic, and improve our data and analytics capabilities. This budget will advance an equitable future for all our district residents, workers, and visitors. We also know that there are non-traditional key factors that have a significant impact on health. The fiscal year 24 proposed budget includes a variety of investments in what DC Health calls the 9 key drivers of health: education, employment, housing, transportation, food, environment, community, safety, medical care, outdoor environment, and income. The mayor's investments ensure that the social determinants of health are addressed and also allow DC Health and its public health partners to effectively address the unmet health needs of residents, less fettered by the other needs of housing, employment, and education. The Community Health Administration, also known as CHA, and the HIV/AIDS, Hepatitis, STD, and TB Administration, also known as HOSTA, continue to make up nearly 2/3 or 62% of the agency's budget. However, most of these funds are federal dollars and tightly restricted to specific programs and allow only for specific expenditures. The proportion of DC Health's funding that comes from federal funds compared to local funds has increased in fiscal year 24 due to both decrease in revenue projections and DC Health's aggressive federal grant seeking. Key enhancements by the mayor's fiscal year 24 proposed budget include $550,000 to provide free dental services for seniors, $324,000 to Martha's Table to support their joyful food markets east of the river. And having released its framework for improving community health in early 2023, CHA will expand its efforts to improve population health through innovations in its maternal health, tobacco control, school health, and brain health programs. Highlights include provide all new mothers in the district free access to Pacify, a mobile app that provides around-the-clock, on-demand, video-enabled consultation from certified lactation consultants. Launch 2 mass reach media campaigns, one to discourage youth and young adults from starting to use tobacco products, and one to encourage established smokers to quit. Implement the district's Alzheimer's and related dementia state plan to address the growing needs of individuals living with dementia and their caregivers. And implement the electronic universal health certificate and electronic asthma action plan to reduce the burden on families to return paper copies to schools. The Center for Policy Planning and Evaluation Activities will be expanded next fiscal year with $3 million in additional federal funds to release the Healthy DC 2030 framework and action plan, the citywide shared community agenda to improve population health, update data and statistical reports on topics of importance to the district, such as maternal and infant mortality, implement a non-influenza respiratory surveillance program, and the State Health Planning and Development Agency will publish a new health systems plan, which will serve as a guide for the next 5 years of public health and healthcare improvements in the district. HOSTA will continue its efforts through a no wrong door approach and continue to ensure that housing and preventive supports are accessible to all. The agency's HIV/AIDS elimination activities build upon the past successes of the Ryan White program, and highlights in fiscal year 24 include planning for an expansion of the Ending HIV Epidemic PrEP housing program to a different high-risk population, and piloting an over-the-counter PrEP program where district residents can obtain PrEP directly from the pharmacy, completing tests at local labs and follow-ups via telehealth, thereby reducing barriers to PrEP. The Health Emergency Preparedness and Response Administration, HEPRA, which supported the pandemic response over the past 3 years, will continue to prepare for future pandemics by reviewing and updating plans, regulations, and trainings based on lessons learned from the pandemic. This includes revising DC Health's medical countermeasures plans, which were used as the foundation for the COVID-19 public vaccination campaign. This revision will ensure that the agency incorporates the knowledge and lessons learned from the COVID-19 response. Improving the Medical Reserve Corps volunteer training and retention program to better prepare staff and volunteers to respond to future public health emergencies. These updates will ensure that plans, equipment, and personnel are up to date and prepared for any future public health emergency. And updating the EMS regulations, which will both strengthen and modernize the EMS system in Washington, D.C. These changes will codify additional levels of EMS care and create opportunities for additional EMS education in the district. DC Health's Health Regulation and Licensing Administration is undertaking expansive efforts to improve the district's healthcare workforce. This includes introduce an updated Health Occupations Revisions Act, also known as HORA, and align board regulations with the new HORA. Build on the Board of Medicine Reciprocity Agreement established in fiscal year 23 by implementing additional regional reciprocity agreements for other health professions with Maryland and Virginia. Issue regulations required by the Dementia Training for Direct Care Workers Support Amendment Act to ensure that all direct care workers in covered facilities are trained on issues surrounding dementia. Issue report on criminal background checks as required by the updated Removing Barriers to Occupational Licensing for Returning Citizens Amendment Act, and introduce an updated Radiation Protection Act and update radiation regulations accordingly. DC Health continues to view all of its work through an equity lens to reduce population health disparities. As the district's health equity thought leader, the Office of Health Equity will continue to take a leadership role within and outside of the agency to drive these improvements. To that end, OHE will complete the health literacy portal and expand reach and use by consumers, roll out and socialize the functioning DC Health Opportunity Index Model 1.0, which will provide new insights into the impacts of multi-sectorial contributions, and demonstrate the utility and power of multi-sector partnership engagement to improve population health through the new Healthy DC Steering Committee, and by December 2023, approve the first action plan. The fiscal year 24 proposed budget also moves the Public Health Laboratory, the PHL, to DC Health. This move will bring DC into alignment with 45 other states, will streamline the existing relationship between DC Health and the PHL. The PHL is in part funded through the Centers for Disease Control and Prevention, CDC, but such funding must flow through the State Department of Health, which in the district is DC Health. Due to that requirement, DC Health has always had a close financial relationship with the lab, and this change would reduce administrative burdens on staff in transferring funds. It will also better connect our epidemiology and public health data teams with the lab analysis and better equip our agency and the district to respond to future outbreaks. Finally, our agency continues to aggressively pursue additional competitive grants to supplement our budget. This includes a recently awarded CDC grant entitled Strengthening the DC Public Health Infrastructure, Workforce, and Data Systems. This funding of $8.5 million over 5 years, starting in fiscal year 23, will support DC Health's modernization of its data infrastructure and workforce to continue moving our agency forward. Mayor Bowser's fiscal year 24 proposed Fair Shot budget continues a strong commitment to investing in equitable health outcomes for district residents, visitors, and workers. I would like to thank our dedicated team of public health professionals for their continued efforts to support our agency's goals as it confronts the new post-pandemic reality. I look forward to working with you, Chairwoman Henderson, members of the Committee on Health, and the Council in support the agency's proposed fiscal year 24 budget to keep all district residents healthy and safe. This concludes my testimony. I am available to respond to questions at this time.
Thank you, Dr. Lewis. We will be on 10-minute rounds. Okay. Before we jump into the budget, I want to ask for a timeline on several reports. So I sent a letter to the city administrator And about the following reports, he said, quote, DC Health is conducting an internal review and didn't provide a timeline. The first, which came up on Monday, is the long-term care facilities and services report. Where are we with that? Or when can we anticipate that one?
And thank you for that question. I know we did discuss a long-term care survey report at the oversight hearing. I just wanted to make sure that it is clear. We did have 2 individuals that started work on that report in the spring of 21 through about September, October. And then, of course, we had a major focus on COVID vaccine requirements for licensure. So with that, we had a delay, but we did have a completed report that was presented to me. I will say that I am reviewing the recommendations with a sister agency, and I truly hope to be concluded with that within about 30 days.
Okay. The second one is the Healthcare Workforce Task Force report and recommendations.
While I am happy to report on that, I did meet with Deputy Mayor Turnage. We did review the report, reviewed some of the recommendations. That report has moved forward as of yesterday into our IQ system, and that is for the EOM to review.
About how long does that take?
So I'm informed that maybe about 30 days, but of course I would have to get back to you on that.
May is going to be a very busy month. About the DC Calling All Sectors Initiative report.
Yes, that report was given to me to review on Thursday, and I'm in the process of reviewing that report.
Okay, so you just got that one.
Yes.
Okay. Let's start with some questions about the public health laboratory, because you kind of ended your testimony talking about this. But so the FY24 budget includes a transfer of the public health laboratory from the Department of Forensic Sciences to DC Health, including 31 FTEs and nearly $500,000 in contract funds. Did DC Health receive any additional administrative funding to house this new program? And by that, I mean HR, procurement, other needs?
No, we have not received any additional funding.
Okay.
Or any funding for the public health lab.
In the pre-hearing responses, DC Health said that you plan to conduct an operational assessment of the PHL. What aspects of the operations will you be assessing?
So we would have to actually have to start from the very beginning to see all of the types of tests that they have the capacity to do. And of course, we would be looking at staffing. We are of the understanding that they, at the time of our initial inquiry into the public health lab, they had about 14 vacancies. So we would like to know where they are with that. We don't have any clarity on their HR support, their OCFO support. So we would need to really learn what is totally happening there with the public health lab so that we can bring them on board and give the proper support and have a very successful new administration within DC Health.
So up until this point, what has the relationship with the public health lab been just essentially transactional as it pertains to the money passed through?
So yes, so and my colleagues can assist with that. So yes, we have been supportive of them with the grant funds that we send.
Okay.
And of course, we have frequent communications with them weekly or more often than that as it pertains to the test results, because that does support the work that our EPIs do within DC Health. And it also helps us to make determinations of different actions that we do have to take within the district as we see positive laboratory results.
Okay. Do you plan to pause or slow down any of the operations while you guys do the assessment?
No, we do not want to slow down any of the operations. We need for them to continue.
Okay. The FY24 budget includes transferring 4.9 million of federal grant funds through MOUs to the Department of Forensic Sciences for services that appear to fall under the public health laboratory. Why is DC Health still planning to quote unquote buy those services from DFS when it will be under you? So the budget that we have still has a proposal of you transferring 5.9 million to DFS, and we're trying to figure out why.
So when we first submitted the budget, it was prior to the knowledge of the transfer. So instead of doing a MOU or interagency agreement, we will now just allocate those funds internally to the lab. So with the transfer, the interagency agreement will not be required.
Okay. So if we could work with you,
The funds remain in DP Health's budget.
Right, but it's in the wrong line item now.
It's, I guess, the incorrect project.
Yeah, yes.
Yeah,
So, Ms. Dean, if we can work with you as we go through to submit the budget, we would just like for it to just put the money where it's supposed to be.
okay.
So over the next 2 weeks, if we could figure that out,
Yeah.
on that front, okay.
No problem.
Thank you.
So in terms of the federal grant funds, I guess then the question I have next is what about the existing contracts that DFS might have for work?
So
with the
that's
public
part
health
of the
lab?
discovery process that we would need to know about all the contracts that they have.
Okay,
We are aware that they may even support some other activities outside of district. So we need to know what all that they do have.
okay. You also mentioned that a new senior deputy director will oversee the operations of the PHL and report directly to the DC Health Director. Is this a new or existing FTE position?
So we would be looking at the director, the current director of the public health lab to be in that role.
Got it, okay. There seems to be some transition pieces here, but not conversations that have had yet happened.
No, we have not had formal conversations with.
Okay.
the public health.
I went to the DFS budget hearing as well to sort of ask some of these questions, because, and similarly with the chief of police, to try to understand, because what we're now proposing is that in one building, you will have employees who report to 3 different agencies, who report to DC Health, DFS, and MPD. And I think in co-locations of spaces are fine, but I feel like there probably needs to be some rules of engagement in terms of who directs what, particularly for lab operations and whatnot. And so it would just be really great if that was something, if you all, well, I don't know, if the 3 had a timeline of some sort of conversation around like putting some things down on paper. So just, I think for the existing FTEs, I think this is probably a bit of an uneasy time for them over at DFS because they're like, oh, so I'm going to have a new boss, a new agency, a new whatever. And it doesn't seem like there have been many conversations that have been had.
Well, as appropriate, I would want to make sure that they have some comfort in knowing that they will be joining us at DC Health. And I will say that as we were preparing for this budget, we are trying to develop a timeline so that we can initiate some of those conversations with the appropriate people at the public health lab.
Okay. I want to ask really quickly in my last little 2 minutes here about HERPA. Sorry. Did I say that right? HEPRA. Sorry.
Yes.
Kept getting it wrong. For those out there, the Health Emergency Preparedness and Response Administration. Okay, so in the FY24 proposed budget, it's being reduced by 1.3 million, which includes cuts in both federal and local funds. What's the rationale for these cuts and how will this affect the district's ability to respond to a potential future public health emergency?
My partners will take that.
Okay. Yeah.
The $1.3 million reduction is a net of a couple of things. It's a net of a 200,000 removal of a one-time FY23 enhancement. And then there was an incorrectly budgeted $107,000 enhancement for flavors ban. That was actually the wrong activity. It should not have been in HEPRA.
Okay.
Throughout the agency, we had to take a 25% NPS reduction. HEPRA had to take that as well. That was the equivalent of 170,000. Throughout the agency, those cuts, with the exception of one particular area, were mostly in supplies. And we just leverage our federal resources for those supplies, and then like employee travel and training. And then there was a federal grant decrease of 710 in FEP and PHER. Some of the stuff that we have with the federal.
Oh, no, what does that mean?
So, right, some of the things that we have with the federal grants are a question of timing, right?
Okay.
So the grants cross fiscal years, and we can only budget according to the amount of the award that we have.
Right.
And so at the time that we had, I think the FY23 one, the budgets were a little bit lower. We did not have the awards when we did the FY23 budget. And in FY 24, we right-sized the federal grants budget. This happened in HEPRA and in a couple of the other administrations, namely HASTA. So there's no reduction in the amount of the award that they will receive.
Got it. Okay. I'm over my time. Councilmember Gray?
Thank you very much, Madam Chair. Dr. Lewis, how are you?
Doing fine. How are you, Councilmember Gray?
I'm doing okay.
Good to see you.
We want to talk a little bit about the licensing issues. One of the concerns I've had when in chairing the committee was ensuring that we had enough medical providers in the District of Columbia. Can you tell me how the reciprocity agreement differs from the physical compact that the council passed several years ago, Dr. Lewis?
Yes, I am excited to share about the regional reciprocity. The executive director for the Board of Medicine and the attorneys worked very closely with their counterparts in Maryland and Virginia, and were able to get, after a period of time, an agreed upon memorandum of agreement. I am excited to say that it's in full operation for the Board of Medicine. Within about a week, I would say that we were able to license 3 physicians through the regional reciprocity. We currently have almost 30 applications that we are processing now. So it is moving forward in a very positive way.
Okay, thank you, Dr. Lewis. Can you tell me what medical professions will be included in this agreement? And are you anticipating an increase in revenue from this agreement from doctors wishing to practice in DC and other states as well, Dr. Lewis?
So at this time, it's hard for us to project how many people will actually apply. My hope is that it will be a significant number of physicians that will apply to participate in the Board of Medicine regional reciprocity. I am not aware that there's any other discipline at this time. I will look. There's no other discipline. It's just the physician. So at this particular time, it doesn't include others like PAs or surgical technicians. It is the physicians. As we learned through COVID, it was a significant need to increase, of course, our physicians within the district to be able to support all of our healthcare facilities. So that is the profession that we focused on.
Okay. Have we fully implemented SIPACT, which was a compact agreement for psychologists? The council passed before COVID.
Yes, we were able to implement the SIPAC compact. And I don't have an exact number, but the last count, I know it was over 160 licensees from other states that are able to provide services here. So that has also been successful. Now, that is the one compact where we do have to pay when others want to be licensed here in the district. That's
Right.
one of the nuances about that compact.
Okay. Last year, I provided some additional funding to hire 10 FTEs to support licensing. Can you tell me if those people were hired and what impact that has had in terms of hiring them and the application process that was involved in that?
Yes, and thank you for that. I will say that we were able to hire at a minimum of 9 individuals out of the 10. And it has made a significant impact. We were able to have some of those health licensing specialists to support the Board of Nursing mainly, but also to support some of the other boards. And with that, we have been able to shorten the time of completing the review and being able to also to respond back to applicants. So thank you very much for that.
Okay. Last year, the mayor convened the healthcare workforce task force to try to address the workforce shortage in the medical field. There were a number of suggestions that were raised at that time. So can you tell me when it will officially be released? And
Yes.
okay, go right ahead, Dr. Lewis.
Yes, thank you. So I will say after several meetings, there were 6 committees that were included in that healthcare workforce task force. And they worked very hard. We were able to come together and do a vote on the recommendations. And then we compiled the document. That document went forward. As I had stated earlier, Deputy Mayor Turnage and I met over the document to review it. And it was placed yesterday into the IQ system, which is for the EOM to review. My hope is that it will be available within 30 days, that, you know, they're able to review it within 30 days. I think it's a very solid document. And my hope is that the mayor will be pleased with the outcome.
Okay, can you tell me when it will be officially released? And are any of the recommendations, Dr. Lewis, are they included in this budget that we're overseeing now?
So the recommendations will, well, actually, there's information on our website, but the formal recommendations and the blessing of it will be released once the EOM has completed their review. But if you were to go to our website, you will be able to even hear the discussion that we had as a large collective group, and even the last voting on the recommendations. However, in regards to when it will be, the full document will be public to everyone, I will respectfully wait until the EOM has conducted their review.
Okay, thank you, Dr. Lewis. Last year, I put additional funding towards Healthy Steps so that we could offer more services in high need areas. But I believe they were, I think they were a bit behind in the expansion plans that were involved. Can you speak to that?
Well, I know currently we have engagement in 5 sites as it pertains to Healthy Steps. If you need more detail about that, then I would have to bring up the Senior Deputy Director for CHA to discuss that.
Okay, Dr. Lewis, it would be helpful to get the additional information if you don't mind doing that. I would appreciate it.
Okay. Dr. Farley, if you can please come forward. He is the Senior Deputy Director of Community Health Administration. Healthy Steps comes under his purview.
Okay.
Yes, thank you for the question, Councilmember. There are 5 sites that are currently funded. There's an additional, an RFP that is out, that is in process, and we hope to announce soon an additional expansion based upon the funding you provided.
Okay, thank you for that. Can you tell me, Dr. Farley, can you tell me how many sites are now open, and if any are planned for next year as this budget moves forward?
So there are 5 sites that are operating now, and there should be at least 1 additional site with the RFA that's out there under review now.
Okay. I wanted to ask you all about the loan payment agreement, which you may be able to answer that as well. Last year, we expanded the loan payment program. Can you explain to me how many people are using this funding and would have been qualified before for this funding?
There was a legislation that went through that expanded or that made more flexible how the funding could be used. It could be used for more specialties, and it could be used for part-time positions rather than just full-time positions. I don't have exact numbers. It's still early in the implementation of those changes, but I'll be happy to get back to you with numbers on those.
Okay. When will you be able to get back to us with additional information on that, Dr. Farley?
Just give me a couple days, very, very soon.
Okay, we would appreciate that very much. All right. I think my time is up on this round. We'll come back to that on the next round. Madam Chair.
Thank you, Councilmember Gray. I want to pick up on where Councilmember Gray was going in terms of talking about a couple of things in terms of HERLA. So in the performance oversight responses that you all submitted in February, March, what is time?
Yeah.
The beginning of this year. DZ Health stated that it needed 8 additional FTEs to better increase efficiencies in customer service for the health professional licensing boards. Yet the budget we have before us sweeps 3 vacant FTEs, 1 for the Board of Medicine and 2 that supported all boards. What was the rationale for these cuts?
The cuts that were made were to support the necessary means of what we needed to address the mayor's budget. With that, we are able to still continue to provide services, but
Okay.
we were.
So in FY23, as Councilmember Gray said, he provided 10 FTEs in FY23. You just said that you hired at minimum 9. So how many FTEs do we currently have?
30 plus. I will look at Aisha Nixon. I believe it's about 30 plus.
Okay, and so the proposed budget would take us down to what?
They were vacant positions that so we would still be at the 30 plus. They were vacant positions that we had not hired.
Right, but they were vacant positions that you need, yes? Okay, I'm gonna let it ride.
Always, always. We would always want to have more positions, but of course we do what's need to be done in the light of our budget.
So also from performance oversight, you know, we had extensive conversation about the food division in terms of sanitarians and the capacity of these individuals in terms of the inspections. So I was surprised to see 2 FTEs cut from those divisions. Now we had a conversation and we talked about, I understand the difficulty it is because this is a specialized job, right? This is not somebody you could just walk off the street and just say, I'm just going to do a checklist, but there are certain things. And so in the DCHR budget, there's 2.5 million that the mayor has set aside for hiring incentives for tough to fill positions. I would have loved to have seen you all keep these FTEs and then try to go for that money to find some other way to recruit people here. I have a question here, but I kind of know what you're probably already going to say is like further limiting I understand that these are vacant positions and you're not cutting people, you're not firing anyone. Did your foods division need those 2 FTEs?
We were always in need of additional staff within that division, for the food division. I will say that what we will do during this interim is that we will continue to conduct the inspections as we have. If we need to look at things differently, of course, we will look at our risk factors. So we have the 5 risk factors. So with that, of course, those that are at the highest risk, we would definitely make sure that we are in all of those facilities as needed.
Okay.
Yes.
Yep.
Can I add? We've also met internally to see how we can revamp how we respond to certain complaints. So that division is split where we have routine inspections and then complaint-based inspections. And typically our complaint-based teams respond to initial triggers. So if someone sends an email or makes a phone call and says that they may have had a problem somewhere, our team immediately responds to that. What we've been doing now is working our 2 partners, our 2 area groups, the epidemiology team, working just a bit more closely with our food services division team, with the intent being that that the epidemiologists would review that particular complaint first, make an assessment of the classification of that, either it's suspect, probable, or confirmed. And then instead of moving on the suspect cases, we will move on the more probable cases. What we've found is that of about 114 responses that we made in 2022, one was confirmed. So what we're realizing, and then in FY23, I think the number was to date, maybe 135. So what we're realizing is that if we tweak our operations just a bit, maybe we can get a little bit more efficiencies in that unit. The hope is that we'd never turn down more, but the hope is that we could not burden them anymore, but just more better direct where they respond to, at least on the complaint-based side.
Okay. Let's talk about animal rescue and control services. This is an area I'm really concerned. I'm hoping we can get some clarity here. Okay, so the mayor swept 4.2 million in the existing balance for the new animal shelter. And yet in your pre-hearing responses, DC Health describes that the agency and DGS have located a site for the new shelter on New York Avenue near the current shelter. To complicate things, the current contractor was at a hearing and she said that was the first time that she had heard about you all finding a new location. So what's going on here? Do we have a new location? Yes or no?
No, we do not have a current new location for the animal shelter.
Okay. Do we have options for a new location?
So there were opportunities where, yes, we did look at different properties as it pertains to whether or not the animal shelter could be located at, of course, we're looking outside of New York Avenue.
Okay. So the mayor also swept the capital budget for renovations for the existing shelter, which I think everybody can admit is in
Yes.
rough shape. So who's liable if, say, I don't know, the roof collapsed? Is it us?
It is our property. However, we would not have anyone in a truly unsafe environment. We actually go out to that property with some frequency
Okay.
because we are, we still have some animals that are located there, and our staff actually go there to do certain tasks. So it's not like we have a building that's not attended at all. You have something else?
Unfortunately, we just did a structural assessment of the roof about a week and a half ago. Following the big storm that, big is relative, right? I'm from the island, so hurricanes are big. But the wind event that we had here
Yes.
the last couple of weeks, we had an assessment done of that property.
Because there was concern or just out of abundance of caution?
That's just how we do it at the Department of Health, but abundance of caution.
You didn't check the roof of y'all's building on North Capitol.
No, well, we have, that's $100 million facility.
Exactly. You see my point here. I look, the Humane Rescue Alliance said that they have some properties as well that they are willing to sort of offer up here, but without any money, we are basically at zero.
So there's been a few things that are ongoing, and all with good intent. We originally identified 4 locations, selected one. We were moving ahead with engaging into agreement with that private entity. That entity then pulled out. That put us back to square one. About maybe 8 months ago now, following that piece, we then started to look internally within DCL. We looked at another site that we thought may work, that we have in Southwest that we share with DHS, our partner DHS. It's a facility at DC Village. And then we had the serious budget constraints that we had, that we fell into. So that kind of put us back. There's also additional considerations that have to happen internally with a $5 million.
Oh, I'm getting there. Let's talk about it. So the contract for animal rescue services was cut from 5.8 to 2.8. When the council cut $1 million from this same contract in FY23, DC Health expressed significant concerns about the impact and went so far as to restore that $1 million in your FY23 supplemental budget. Now you're cutting $3 million from the same contract 1 year later. When we talk to the Humane Rescue Alliance, they say 2.8 is not enough. How are you all convinced that they can provide the level of service necessary with that amount of money in the contract?
Well, before my partners discuss the actual financials, there's one thing that I think that we do need to clarify. I think what was stated on Monday is that they had a contract with us through 24. So our actual contract is through the September of this year, and then we have the option year. So I just want to make sure that part is clear. Now, as it pertains to the funding, Mr. Fletcher.
The funding that we have, the budget was originally 5.9, reduced to 4.9 in 23. It included a one-time enhancement of 2.36. That's the 2.36 that was reduced and moving into FY 24. Arguable that would be
There's only 2.8 there that we see.
arguably it would be difficult to continue to maintain
The level of service, which also is.
under the current operating model.
Okay, I'm over my time. We're gonna come back to this. Councilmember Gray.
All right, I was gonna ask about dental care, Dr. Lewis. Can you tell me how the current senior dental care funds are used at present, Dr. Lewis?
Yes, so we do have a partner for our senior dental care. As you know, we had the 500,000 in 23, and then in 24, the 550,000. We have a partner with Community of Hope, and we are able to provide services. I think that there was a public witness on Monday that spoke very favorably about the services that he or she was receiving at the Community of Hope as it pertains to dental care. In fact, he even talked about implants. So it's everything that you can receive.
Okay. I guess similar question. Are the funds to account for the higher cost of dental care, or do you believe you can serve more people with the proposed budget, Dr. Lewis? Can you clarify that for us?
Yeah, so our hope is that with the additional funding that we have, the additional 50,000, that we will be able to do both, be able to serve additional persons that are in need of dental care, as well as accommodate any of the costs, the increased costs that now follows along with receiving dental services.
I see. I want to turn to school nurses, if you don't mind, for a bit, Dr. Lewis. Last year, you worked hard to provide funding to increase access to school nurses. Can you tell me more about the shift in strategy for school nursing and how schools will be covered in this proposed budget, Dr. Lewis?
Yeah, so with that, I'm trying to remember the number of health suites that we have. It's somewhere between the 150 and the 170 range. What I will say that our contract that we do have with Children's Health Services to provide nurses in our health suites, you know, it has been somewhat of a challenge. But with that, we are looking at a number of different models that we will hopefully be able to implement, especially this coming school year. So we're in the process of having discussions, initial discussions with OSSI as it pertains to that. So we are looking at our health, various health professionals that will be able to be placed in the health suite so that we can have expansion and more people present in all of the health suites. And then, of course, in addition to that, we still have telehealth that is available if needed.
Okay. I wanted to ask you about the respiratory surveillance program. You mentioned that there will be a non-influenza respiratory surveillance program. How much is this going to cost? How much is it going to cost to do this program?
So at this time, I don't have a firm dollar amount as to what it's going to cost, but I will say that within our CPP administration, our EPI team is really excited about developing this further. Excuse me. So we want to make sure that we're able to track a number of different respiratory diseases here in the district, not only flu, but RSV and others. So we are going to still continue though to collect that information and to see what we can to develop further, possibly a dashboard or other activities that our state epidemiologist does have in mind.
Okay, Dr. Lewis, I appreciate that. As you think through this, will it consider some of the biggest factors in respiratory illnesses, like environmental factors, like mold, of course, which is a big factor for many people. Secondhand smoke, which the agency currently does not test for these. I don't think you test for those issues. Is that right? Can you address those issues as you continue on in your testimony?
Yes, and as we have our administrations that work closely together, even within our community health administration, along with our CPP administration, within CHAR, you know, they have the tobacco program. So with that, we do look at secondhand smoke in the environment and those influences as it pertains to asthma, which is also falls under the community health administration, all of those influences. If there's any concern with mold, of course, we reach out to our sister agency, Department of the Environment, to involve them in discussion if there is any need as it pertains to mold. But within DC Health, we have the at least the minimum of the two administrations that do work hand in hand. And then, of course, I cannot forget our Office of Health Equity, which, of course, has that overall lens that looks at not only the environment, but the health and safety of what happens with the residents of the District of Columbia.
Okay, thank you, Dr. Lewis. Can you explicate just a little bit further where you are in reaching out to agencies that may be helping to address the mold issue, Dr. Lewis?
Well, I have not been made aware of any mold issues, but if we do have them, we have reached out to the Department of the Environment. I'm only aware of one question actually that has come in to us about mold, and we did reach out to them. But we have not had any, what I would say, any significant number of concerns that have been brought to us from our residents, may it be a complaint or inquiry, to ask the director.
Okay. I think we had some inquiries that were raised with respect to Howard University because they had mold issues, I think, that they were trying to address. Are you aware of that, Dr. Lewis?
I am not aware of that. Can you enlighten me? I'm not aware of Howard having mold issues. Howard University Hospital or the university? The university. Okay, so the university would not come under our purview, but of course we are willing to support any and all facilities within the district, especially if we have any of our residents or students. They're just as important to us. So with that, if they need for us to intervene on their behalf in any way, they can reach out to us, and we would work very closely with DOEE.
Well, we appreciate that. And you've always been wonderful in terms of following up on these issues, and we'll appreciate your continued support to try to address these issues as we go forward.
Okay.
We have a close relationship in working with Howard University
Yes.
as well, and I will look forward to the opportunity to follow up with you as well on some of the other issues that Howard has raised with us. Okay.
Okay, I will look forward to that. Thank you.
All right. Thank you, Dr. Lewis.
I've made note. Thank you.
Okay. I think there's some other issues that we may want to raise, but I won't right now. I'm running low on this time, so we're just about out of time. So let me follow up with you on those. Okay.
Okay, I look forward to that. Thank you very much, Councilmember Gray.
Thank you, Dr. Lewis.
Thank you, Councilmember Gray. So let's return back to animal control. Dr. Dr. Lewis, how long has DC Health contracted out these services?
I believe we've had relationships with HRA since 1980,
Okay,
so it's been a long time.
older than me.
Yes.
And so at this point, I think we have a pretty good idea of what it will take for them to provide the services that they will, given the increases, given inflation. But 2.8, we can agree that's not it. Yes? Or do you all have some other calculation that would lead you to believe that they can perform these functions for 2.8 million?
I don't have a calculation for them, but I will say that as they do present to us their monthly invoices and what they do expend, we do look at them very closely to make sure that they do align with the services that they provide for us, to ensure that they're not mixed with any other services that may be provided by them. So with that, I don't have a firm figure. I could probably get back to you on that.
Okay, so how did we get 2.8? I heard Mr. Fletcher, you said earlier, as kind of an offhand, but that 25% NPS reductions were required across the board for all divisions. But I have to imagine you guys went back with a scalpel to determine like what we really couldn't cut versus what we could live without. This doesn't seem like fat to me. This seems like essential.
So the number started off with 4.9 that was approved. It included a one-time enhancement of 2.3.
Okay.
That one-time enhancement came out. That would have left the budget at 2.6. We scraped elsewhere, we found 200, and that brought it up to 2.8. So what you're seeing is the reduction of a one-time enhancement that was not subsequent
2.3.
of 2.36. Yes, that was not subsequently funded in that point.
Okay. I don't want to belabor the point there.
I hear your concern, but we will look into it.
As will we.
Yeah.
We will work together to figure this out. But I have to respond. I have your contractors telling me they would have to fire half their staff. Right. And I know what I see on the listservs. I know what emails I get from people about the creatures and things that they see in their alleys or in their backyards or in their whatever. And so and this is not just for DC Health. I said this to the mayor. I feel like, yes, you're touting the 750 government workers that you cut, but then what does that mean for service on the other end? And this is one of those conversations. What does that mean for service on the other end? Is there going to be somebody who actually picks up the phone when somebody calls with an emergency? So we'll get there. Can I ask, since we're talking about HRLA, do you have an update on plans to transmit the HORA update to the council?
So I think when we met the last time, I did have the HORA that was under my review. I have reviewed it. I have actually transmitted it for additional revisions.
Okay.
And so I'm waiting for it to be returned back to me.
Okay. So I want you to know internally, I've been trying to do you a solid because I have some of my colleagues and advocates who would like to do pieces of HORA related items. One of them, and we heard testimony on this on Monday, but we've also heard testimony on this during performance oversight, is lowering the age for certified nurse assistant from 18 to 16. Is there a particular reason that we should not do that now?
Well, I would say that for the age 16 to 18, that is specific to the CNA and home health aid program.
Correct.
And actually, I would probably want to speak with my general counsel to see if that would be problematic to just piecemeal that out. What we're trying not to do is, because there are a number of different revisions within the HORA that I think a number of people are waiting for, and we're trying to move as quickly as possible. And my thought is that I should be getting the revisions back shortly, because that was the earlier part of March when I finished my review. And I think that they're about almost completed with their review. Yes, so it should be coming back to me shortly. So let me talk with the general counsel to see,
Okay.
how quickly we can move forward with.
Because I have the CNAs asking for something. I have the pharmacists asking for a change. I have the folks want to change the social work requirements.
So, yeah, so let me just share one thing about.
If
the
we do
pharmacists.
one,
Yes.
then I feel like I don't have to do something for everybody else.
Yeah.
I'd like to do this in and have a comprehensive conversation. That is my preference, is to have a comprehensive conversation. But the longer this takes, the harder it becomes.
Yes, well, it had been 17 years before that document had been touched. So we have spent a lot of time. It's been over a year that I know that we were working very hard. So my hope is that they can appreciate the amount of effort and work that's gone into making the appropriate revisions. There is one thing that I do want to touch on about pharmacy. So yes, with the PrEP Act, let me back up. If I were to look at May 11th, the pharmacists are not really affected by the end of the federal emergency pandemic, May 11th. Actually, if you look at the PrEP Act, it goes until October of 24. So they still have that capability to administer immunizations to age 3 and up. So I'm not sure if the person was clear on that. However, within the HORA, we have included that component in the HORA. What is different, though, in the revised HORA that we want to move forward, currently with the PrEP Act, there has to be like a, what do you want to call it? Like a listing of those things that the pharmacist can or cannot do. There has to be a script that's written out. They will have autonomy within the proposed HORA that we are moving forward. And I think that they would be pleased with that.
Okay,
So-
so May 11th isn't a trigger for them.
That's correct.
They have a little bit more time.
That's correct. That
Okay,
is correct.
okay.
Now, in regards to the other thing that was discussed, that would not come under us, trying to be into, providers and being paid, that's not in our space.
Right, that's healthcare finance and
Okay.
that's a whole different thing. Yep, no, understood. Okay, so we'll check in on this in
In
the.
30 days.
I just,
I was successful in getting some things through, though.
no, you were. And that's the trouble. I told my staff, I was like, or I guess we had a conversation yesterday about BSA, and I was like, I hope none of you have reporting requirements, because clearly reports is not a strong suit of this government. Not y'all, everybody, sort of writ large, but okay. But we'll come back to that.
Okay.
For CNA in particular,
Yes.
we have an LEA who is interested and wants to develop a program, not for school year 23-24, for school year 24-25 is when they'd like to launch. But if they're going to do that, they're going to need a year for planning. And so they're looking for some understanding of a timeline for us.
Understand.
Okay. Now you mentioned something, I'm now going out of order. Sorry, Ona, but when you talked about pharmacists are covered to provide vaccinations for kids over 3. And then, of course, that triggers a conversation about the COVID centers, because you may not know this, but the COVID centers were like the easiest place if you had a child under 3 to be able to get vaccinated for both flu and COVID. Because A, you can get an appointment at your pediatrician's office, or B, the pharmacies don't do it. And so we've had a number of folks who have testified, or not number, there were 2 people who testified. I've received a lot more emails from folks, and we asked some pre-hearing responses to you all. And I just want to follow up on a couple of things. So after May 11th, when the CDC no longer requires case counts, how will DC Health keep track of local COVID-19 rates? What data, if any, will be publicly made available?
So many of the public health departments are moving away from having their dashboards and all on the website. Of course, we will know what is occurring within the district because of our EPI team. So we do have that relationship with the public health lab as well as our hospital. So we are fully made aware of any positives If we have any concerns, of course, we will make that known to our population. But at this particular time, we are beginning to wane down on some of that information because our numbers have been so low for a significant period of time. You also made reference to parents wanting to make sure that they're able to have their children receive any type of immunization or vaccines. You know, it has been since COVID that we have really wanted to make sure that our parents reacquaint with not only their primary care providers, but also to get their children back to their pediatricians. As it pertains to anyone looking for places to receive vaccine outside of their primary care provider, of course, we have the Urgent Center, Cedar Hill Urgent Center, for example. We have some Safeway locations. We did make that public to district residents of places where they can go. Many of our residents have antigen tests where they can go ahead and do testing. And if they find that they have a positive, of course, what I would hope that they would seek out care, not only with their primary care provider, but they can also go to an urgent center.
Okay, so let's break down a little bit of this though. I mean, I think one of the right now it seems fine because I think the most sneezing that's going on is because of pollen.
That's good.
But there are surges that take place.
Yes.
You know, last winter, fall, RSV was like really big in terms of the pediatric cases, which was making it much more difficult for folks to get in. You have the surge in terms of flu. Is this budget prepared for surges? Meaning that if we in our area see a surge around, whether it be COVID, whether it be Mpox, whether it be flu, do you have the capacity to make some decisions to open up public sites through this budget?
So I will say, I'm not sure that we still would have the leases. I think the leases would end, but I think that if we have any type of public health concern within the district, that we along within DC Health, our HEPA team, as well as other administrations within DC Health, we would rev up and make sure that our district residents are taken care of and do whatever we would need to do to make sure that the appropriate services and treatments are made available.
So one public witness testified that they can no longer access the free PCR test since the COVID centers have closed, and that this can in turn impede their efforts to get COVID treatment like Paxlovid. I said that right? Paxlovid. So what would you tell that person?
So that they can still seek out their primary care physician or go to the urgent center and get a prescription for and get the Paxlovid. So it's not that it's not available to them.
I think she was making the connection that in order to be eligible for Paxlovid, you have to have a confirmed positive. Is that incorrect?
She can still get that appropriate test at an urgent center. And she can go to her primary care physician and then the test would be sent out to, I don't want to name any particular lab companies, but it could be sent out.
Okay. I mean, I think we though need to acknowledge, and I feel like perhaps the federal government also has not really done a good job of this, of insurance companies are not covering these tests 100% across the board, right? So there's still some sort of copay or out-of-pocket expenses. And I think this is with anything in government, right? I think people have gotten used to being able to just go to a library, pick up a test, take it, drop it off, getting emailed their results. The convenience piece, but also the lack of a financial contribution on their part in order to do that. And so I think it's going to take some time for a transition, but I think we need to be better clear around what does May 11th mean? And I won't get into that fully because we're going to have a hearing on this, just on the end of the public health emergency, so that all of the agencies can just be very clear what happens, what doesn't happen. But again, my point was I want to make sure that this budget allows our health department to say, okay, the numbers are getting out of control. We know that folks can't get appointments, so we need to open up a public site, and that we have the flexibility to do so.
Yes, and I will say with any disease entity, if we see a rise, then of course, our true responsibility as a public health agency is to make sure that we are responsive and can address that. But let me just say this, that I think that hearing what I think that I'm hearing in between, that there may be some uncertainty, what people may need to do. I know that we have done one wave of sending out information to the public. Let us go back and take a look to see if we need to provide some additional information.
Yeah, I mean,
Direction.
the internet is a place now where people find all kinds of things that may not be true, and sometimes it
Yes.
is. And so we just need to be the clarifying piece out there. We understand that the district still has about 700,000 rapid antigen tests that will expire in December 23. And that you all said you were working with OCP to distribute this test to workplaces, schools, and nonprofit settings. Excuse me, are you all confident that these tests will be distributed in time for them not to expire?
Yes, we are. If we find that we're getting close to the expiration date, then I'm sure that we would revisit if there's some other opportunities that can be made available to others, but yes.
Okay, so as part of that 700, I'm just sort of thinking, because I just got an email from the chancellor about test to return. Are you all still providing, is this the source of the tests that DC Public Schools is using for test to return?
That I need to check on. Is that part of that? Okay.
Come on up to the table. And you just introduce yourself for the record.
Senior Deputy Director of the Health.
Oh, say it again, because your
Oh,
mic wasn't on.
Sorry. Patrick Ashley, Senior Deputy Director of the Health Emergency Preparedness and Response Administration, or HERPA or HEPRA, depending on what you prefer. So yes, we've already supplied DCPS with enough to get through the entire school year. They maintain those in a separate cache within their warehouse.
Okay.
That's already been transferred to them. 700,000 remain available to be distributed out to the public. We also have a contingency cache of about 150,000 that DC Health maintains in case of some sort of surge.
Okay, so I'm going to ask you this for the record so that everybody in the public can hear it. Why can't you just put tests behind the counter at the libraries?
It's a great question. So they do have value, and we have to have some sort of custodianship over those tests to prevent fraud, waste, and abuse.
You think the librarians are going to steal them?
No, so what we saw actually early on in the pandemic is people would try to take cases of those. The libraries, we have to provide staff resources to actually supply them to be able to restock them. And it's not something the libraries are willing to do or have the resources to do.
Okay. While you're here, because we get the questions, why can't we have a mobile van that go from ward to ward every day of the week, providing vaccines, testing, masks, et cetera?
It's not something that's out of the question. We would just need funding to do that.
And how much were the COVID centers? How much do they cost now? Or did they cost?
Each one costs about $1 million a month.
Each center?
Each center.
And there were 8.
So $1 million that included vaccine, masks, staffing, and then the leases.
That's correct, except for the cost of the leases.
Wait, oh, I'm sorry.
That did not include the cost of the leases. That was just staffing and all the resources that supported them.
Okay, a month.
A month, yep.
Did we get all our money back from the feds?
I believe we've gotten most of that back.
Okay, that's great to know.
Yeah.
What'd you say? Mr. Butcher?
Different rates. They're different reimbursable rates. So at certain times you get 100%, at other times you get 90%, at other times you get 90% of 90%. So they have different reimbursable rates that you get, depending on which side of the funding you go to. So if it's FEMA PA reimbursable, it depends on when the expense is incurred. You're eligible for 100%. Different times it changes. It's directly grant funded and related to COVID, then you have another place. So it depends.
Okay, but after May 11th, anything we do towards this would be a cost incurred locally by the district.
100%.
All right, I need everybody to sort of hear that. But like, let's just play this out. Does DC Health own a mobile? I think you guys, do you have a mobile unit?
We do not.
Y'all don't have a van that says DC Health on it?
Yeah, we have a few vans, but they're not.
No, I know. I thought you guys had like an RV thing.
We do not have one, not that's set up for clinical services.
Yeah,
Okay, great.
we don't.
Hold on, hang on one
And
second.
I think people were getting tested.
Yeah, it wasn't that many.
Yeah, and I think it's important as well, about a third of the population was actually utilizing the COVID service centers. What we saw is actually 2/3 of the vaccinations were actually delivered at locations throughout the community that were not DC Health COVID centers.
Right.
So while convenient, there's still a significant amount of capacity in the district.
Sure. But again, I got to hold it down for my parents who have kids under 3. The COVID centers and this, and let me publicly thank the staff who were phenomenal in how they dealt with those little people who don't like needles and don't like to sit still. They were the consummate professionals in terms of their delivery of care. One thing we noted, so we asked how much vaccine doses we have left, as well as how many masks we have left in the supply, and you guys didn't provide an answer to those.
So I can give you the specifics if you want. It's constantly changing. We order that directly from the federal government.
Okay.
And then
Vaccines.
the vaccines.
Yeah.
And then we provide that out to the providers so that they can order on demand. So I believe it was about 1,500 vials of vaccine across about 30 different products or SKUs.
Mhm.
And so we don't maintain a significant amount on hand because that's what we DC Health maintain. The providers also maintain some as well.
Well, it has shelf life, et cetera. What about masks?
I don't know the answer to that. So our inventory for mask is actually maintained by the Office of Contracting and Procurement. We can get back to you on that.
Okay. In your testimony, Dr. Lewis, you stated that the Center for Policy Planning and Evaluation will implement a non-influenza respiratory surveillance system in FY24. Is this related to the continued COVID surveillance, or what does this entail in particular?
So it's not necessarily related to COVID. What we've been looking at over a number of years is how can we capture what is happening in the district as it pertains to respiratory disease. So with that, the state epidemiologist is really excited in that he now has a staff where they can truly focus on respiratory illnesses and diseases here in the district. So flu as well. I know it does say non-flu, but they will still capture flu, the RSV, which I think many of us knew about. It doesn't mean that we're going to forget about COVID. We still need to monitor that to see if we have any significant surge, let's say in the fall or late summer. So they really are excited that they can start measuring that. And then, of course, again, have communication with our community health administration as it pertains to the asthma program.
Okay. So you might be aware, we've gotten a number of communications as well as heightened news awareness from students at GW around, well, I wouldn't say it's just students at GW. I would say college students in our city around the fact that if someone experiences sexual assault, there's only one hospital that you can go to that has the sexual assault nurse examiners. It's Washington Hospital Center. And I discussed this previously with OVSJG, the Office of Victim Services and Justice Grants. But I'm curious about DC's health perspective as someone who oversees the hospital facilities. How can you all increase access to this vital service at more hospitals? I'm not sure if that's something that has been discussed or contemplated. I believe there's a training that takes place, and we don't require that every hospital have at least one person who is trained. But I think for the students who have spoken to me, right, they're at GW, you go to GW Hospital, and then the hospital informs you, oh, you have to go across town to MedStar, to Washington MedStar, or you have to wait until they can send someone over.
Yes, and thank you for that. And yes, of our 13 hospitals, we have 7 acute, with one of the acute being children. So let's look at the other 6 hospitals. Washington Hospital Center is our hospital where they have, we refer to it as Zane, Z-A-N-E, if I remember correctly, how it's spelled. And their staff are trained to not only the physicians, but social workers and nurses are all trained to be able to take care of a sexually affected victim. I have not heard from the other hospitals reaching out stating that they are seeing many victims or they're interested. I think that may be some of the conversation that maybe we can reach out to Jackie Bowens to start with.
Okay.
And I think that would be good. We have had routine meetings with her and she's always been very open and willing to work with DC Health. So I'll put that down as an item to reach out to her.
Okay, great. Thank you. Because I'd like to be responsive to those young people. And considering the number of college students aren't the only
Yes.
ones, right? I think
Yes.
it's across the board. But if you've gotten yourself together to even go to a hospital to report, and then we tell you, sorry, you're at the wrong, we can't do that. We need to do better, especially here in the nation's capital. Let's talk a little bit about HOSTA. In the public testimony, we heard that DC Health has ceased much of its sexual health education and condom distribution for middle and high school students at the beginning of COVID. In the pre-hearing responses, you all cite that the Youth Advisory Board is slated to start or restart at the beginning of school year 23-24. This is limited to only 20 young people though. So what's DC Health's broader strategy to, I guess, get back where we used to be in terms of sex ed?
Yes, so that is true. We're right now we are working very closely with OSSI as it pertains to confirming the MOA with them or MOU with them. Our lawyers are looking at the language. So that will not actually be ready and effective until the fall. So that'll be the new school year. However, I know
That's for the MOA for the Youth Advisory Board?
that is correct.
Okay.
However, I will say that Clover does have her staff that are in the schools once or twice a week, and they are communicating with the youth and passing out condoms. And why don't you further explain the activities that are happening?
You just introduce yourself by the record.
Clover Barnes, thank you. I'm the Senior Deputy Director of HOSTA. So we do have some students, some staff that are out now. I just want to be clear that HOSTA has never been in charge of sexual health for schools or OSSI or anything like that, but through a partnership with our expertise and their needs, we have worked together to support the Youth Advisory Board and to provide STI testing and HIV testing in schools. Some schools that even have school-based health centers. And so we work with OSSI to that. We haven't ever had funding that paid for youth sexual health explicitly at HOSTA. We've always worked with OSSI to make that happen.
Okay.
So we can do as much as we are allowed to through the funding and the MOU that we have.
Okay, but the RAP-MC program, that was you guys, yes?
Yes, that is a condom campaign that we had. And
Okay.
so we distribute almost 4 million condoms throughout the district to all sorts of businesses and entities.
Okay, are you restarting the certification program? We're under the impression that there was some certification that someone needed to go through in order, like you all had some sort of certification, condom distribution certification program that stopped.
So I'm not sure about that. Our youth ambassadors are trained and they receive a certification to go out and do the education. They do peer education and peer-based sexual health exhibits and social media postings and whatnot.
Yep.
And so we would train them and maintain that board. But the condoms are still available. If anybody wants condoms, you can order them from our website at this point right now on dchealth.dc.gov. And we will either deliver them or you can come and pick them up from the health department.
Okay. So DC Health used to have a sexual health peer education grant program that was administered until 2019. Are there any plans to restart this?
I am unfamiliar with that. I'm sorry.
Okay. Okay. We'll circle back on that. It's on your website, so that's how I know you used to have it as well.
We'll work on our website.
Yes.
Well, the government needs to work on the website. No, but also I remember this from when I was a staffer here. Yes, there were organizations who did this. Yes, okay. Okay, we'll move on. We don't go right away. So from our records, we have that DC Health has only distributed 324,000 total condoms in the district so far in FY23, showing a significant slowdown in comparison to FY22. Are we changing our strategy here, or are our numbers not a great reflection of what's currently happening?
No, we're not changing our strategy here. We actually are implementing a better way to track
Okay,
and to report, like the entities that they go to, how many go, what kind, because we give out all sorts of types of condoms.
Mhm.
And so we are not on a slowdown at all on condoms. We actually get lots of requests daily. And so I think we just need to track it better
Okay.
than what we have in the
will the mini grants for HIV prevention for Black women continue in FY24?
Yes,
Okay, what's the funding level for those?
their level. I think it's only $75,000. That's
Okay, Hey.
afforded to it now.
in this budget, to be level and not be cut is a blessing. So 75,000, okay. Have you already awarded these grants for FY23?
The awards, the applications are under evaluation right now.
Okay.
We're looking to make those awards as soon as possible.
Okay. Okay, so DC Health did not restore the council's earmarked funding grant for Joseph's House for their care and support of low-income individuals living with chronic disease like HIV, AIDS, and cancer. What's the rationale for not continuing this grant? Was it because it was a one-time and all the one-times got cut? Somebody has to say it out loud.
250K of it was one thing.
Right. Did this to just succumb to the fate of any one-time funding source was not continued?
Yes.
Thank you. Okay. All right. In your testimony, Dr. Lewis, you mentioned that HASTA will be expanding the Ending the HIV Epidemic housing program to a different high-risk population. What population is that, and how many individuals are you hoping to reach?
So that is all still under planning right now.
Okay.
Depending on the population that we are attempting to house, the planning and the housing opportunity needs to be different. So what we have right now is same gender loving men or MSM housing. And those apartments are shared by two people in one apartment, each having their own bedroom.
Mhm.
For different populations, we believe that we would need single occupancy locations. And
Like,
so
units altogether?
Yes, like one person in one unit. And so we need to plan out and source where those locations will come from before we start to advertise and talk about
Okay.
the populations.
But you're confident that come October 1, you will have some direction
Yes,
in where you're going.
yes. We
All
have a plan. We just can't operationalize the plan until we have the housing secured. Does that
Okay.
make sense?
Have you identified the population?
We have a probable population. Our target is to work with transgender women.
Okay.
That's the population that we're looking to target. But like I said, there are different nuances that go with housing transgender women that's different than housing same gender loving men.
Right.
And we have to work out all of those nuances.
Okay. Thank you.
Mhm.
Community Health Administration. We're just going to go down the list. We're
Yes,
getting there,
yes.
guys. Don't worry. We're actually probably going to take a break in about 10 minutes here. Hello, Dr. Farley. Good to see you. Okay, so in DC Health's performance oversight responses, you all listed heart disease, cancer, and unintentional injuries as the top causes of death in 2021. How does your FY24 proposed budget invest strategies to get at each of these areas?
We're focusing on tobacco and diet and physical activity, which get at heart disease and cancer. Tobacco control, there is media campaigns, in the works, as well as purchasing the CDC's media campaign for distribution in the district. And then a lot of work with healthcare providers so that when people come in to get medical care, they're asked about whether they're smoking, and there's a process for a smooth referral for them to our quit line where they get a variety of quit services. In addition to that, the council passed the flavored tobacco prohibition, which we think was a major step forward. And we're not responsible for enforcing that, but we're working with the LCP, I got to get the acronym right, to make sure that they are enforcing that. And so that would mean that people are less exposed to the promotion of tobacco when they go into retail stores.
Right. Let me ask about the flavored tobacco. Did we figure out the website issue in terms of the exemption facilities to be able to apply for the exemption?
I'm not sure I understand the question.
I think we talked about this a little bit during performance oversight. For like the cigar and hookah bars that were carved out as specific facilities, they still needed to like apply for an exemption with DC Health. I believe there was an issue in terms of the application on your website.
Not sure what the issue with the application website. We do receive applications and we do grant exemptions when they meet all the criteria they need to meet to get an exemption.
Right. Okay. So no complaints that you know of, that you're aware of that process at the moment.
Well, there may be some complaints from people that don't qualify, but the ones that qualify.
Process complaints, not qualification complaints. Okay. So DC Health did not restore the council's one-time enhancement for most of the healthy food access programs, except for Joyful Markets. So y'all did keep something that we did. Why did you all decide to maintain the enhancement for that program, but not for the other ones? And the other ones I would, Produce Plus, Healthy Corners, home delivered meals. You kept Joyful Markets.
Great answer. There are a variety of food programs that make healthy food available in a variety of different ways. As you know, one-time funding in general was not restored. The Joyful Food Markets provides food to children in schools. We think investing in children is a good thing to do. Obviously, we would like to have more healthy food available everywhere, but within a limited resource environment, that was one spot to have it for children.
Okay. Not okay as in, I think the cuts are okay, but okay as in, thank you for that explanation. I had a chance to like go out and see a couple of the Healthy Corners and or the Healthy Corner grantees and actually like talk to the store owners. And it's kind of amazing in terms of what introducing fresh produce can do to their business altogether, right? Because then you have folks who are using the Snap Match. And then while you're over there, you're like, oh, let me pick up eggs and I'll grab milk. Oh, and let me get ice cream. And it is helping in terms of people really viewing the stores more like, I don't call them wholesome, but like more full and sort of like the corner store actually being able to provide those necessity items as opposed to just junk food. So, yeah. But I was happy to learn in your pre-hearing responses that DC Health successfully applied for federal grant funding to continue offering fresh produce in the Grocery Plus boxes for over 5,000 low-income seniors for the next 3 years. The program that was piloted in FY22. Is the federal funding that you all receive sufficient to cover the fresh produce for seniors participating in the program, or is this just a subset?
It adequately covers the seniors that are currently participating in the program.
Okay. So Councilmember Gray asked a little bit about the dental services, but I want to just kind of drill down more. How many seniors use this program right now?
I don't have the numbers for that. I have to get back in the numbers.
Okay.
Certainly, the need for that is far larger than the funding that's in there. Seniors, when they become eligible for Medicare, there's a lot that's good about that, but then they often lose their dental coverage. So we have a very large number of seniors that don't have dental coverage. So this program only covers a very small fraction of that.
Is it, in terms of the mechanics, do we limit how much each person can get?
No, it's, the grantee Community of Hope makes this available to people and advertises that even if people who don't have dental coverage, they can come in and get their services. And if they don't have dental coverage, those services are covered by the program.
Okay. Is that at all of the Community Hope locations that you can go to or just one?
I believe there are 2 locations where it's available.
Okay. There was no additional. Hold on. Okay, so the council passed the Dementia Training Act of 2019. There was funding that was added. I think it was $170,000 to do the dementia training, but in FY22, the budget was never spent. So what's the status of the implementation of this law? And do you all have sufficient funds to implement the law in FY23 and 24?
Okay, I believe that that's not the program that falls under CHAR, that is the program that falls under PERLA.
Okay.
And so with that particular program, what was realized was that regulations needed to be written. And they are in the process. I will say that Renata Cooper has been working with the attorney, Kia, to finalize the review of the drafted regulations, and then they'll have to be moved forward. But with that said,
So the regulations have to happen before we can move forward with. Okay.
the total program. That is correct.
Okay.
But however, along with that, there's a couple of things that are happening. So Ms. Cooper has been working with the, at the time it was the Board of Nursing educator, to reach out to find out what are the resources that are out there that we could potentially approve as it pertains to courses for dementia, information on dementia for our the healthcare facilities that fall under this particular law. So that work has been done. We've had some limited communication with the Alzheimer's Association. And in addition to that, the current regulations, for example, for assisted living, requires already for the administrator to complete a set number of hours in dementia training, as well as some of the staff. And most recently as well, the nursing home regulations have specific requirements for dementia training. So I just want you to be aware that even though we're still working through the regulatory process, there is still activity that is happening in our healthcare facilities as it pertains to making sure that the staff are trained on how to work with clients with dementia.
Okay. Will DC Health spend the $250,000 in FY23 to fully implement the Alzheimer's service public awareness campaign?
Yes, we will. That campaign is in development right now.
Okay.
As they're shooting and preparing the materials. Should air soon.
Thank you.
Okay. In your testimony, Dr. Lewis, you described that DC Health will roll out an electronic universal health form and asthma plan for schools. Caught my ear.
Yes, yes.
Will this be in time for school year
Yes,
23?
Dr. Farley is working very hard on that. Dr. Farley, let me let you go.
The current timeline, working through the IT challenges, it's not simple. Have been scheduled to be right around the beginning of school year. So, the glitches, it may not be before the start of school year. It would certainly be during the school year.
Okay.
I want to just also clarify what I probably wasn't clear as clear as I should have been in the oversight hearing. That is, the immunization data itself is already electronic.
I know, but
This
it's
is
the
just
other
all the
stuff.
rest of the information.
Yes. Okay. I guess in that same vein, what's our plans for this summer? Are we going to do the same push that we did and the same types of partnerships with providers to provide, pop-up clinics, et cetera, around communities for families to get ready for back to school?
Yeah, we'll have expanded access for vaccination of children. Not quite at the scale we had last year because there was a lot of those slots that were not used, but they're certainly adequate so that when parents want to have their children vaccinated, there are the opportunities. Some at schools, at school-based health centers, as well as their routine pediatric provider, which we recommend that they go to the routine pediatric provider.
Mm-hmm. That's what I told the My School DC team. I said, when you send out the results, you should just attach and make your pediatrician appointment now to get your form because you need that. Like we need to marry these two together. The same with DCPS. They keep sending out enroll, but don't say, but you also gonna need your health form filled out as well. And so I think we just got to get folks into this regular routine so that folks don't wait till the last minute and then they're like, oh no, I can't get an appointment. Like you waited all summer. Okay. The FY24 budget proposes an increase for the Howard Centers of Excellence in the local budget by almost 2 million. What does this center do?
There are 5 centers in the overall Howard Centers of Excellence program.
Okay.
And each one of them has infrastructure and staff that is funded. Overall, they're to be doing research, community education, patient care, and with the overall goal of having it be a center of excellence so that they're doing the best they can for promoting that, addressing that particular health problem, as well as raising up the quality district-wide.
Is it the hospital or the university?
University. I mean, it's the medical center. So.
I mean, they're independent now, or I mean, they're split. So like,
It's
that's what I
the
need to know.
university.
It's the university. Okay. So it's more academic in nature.
I wouldn't describe it as academic in nature. I would say that there's an academic component to it. They should be doing some research, so that they are building cutting edge solutions to health problems, but they're also disseminating those across the district.
Are we its only funding source?
Yes. I should take it back. We're the only one that we're aware of, there are staff at Howard providing clinical care and doing research as part of what Howard does. As far as a specific center of excellence label, as far as I know, we're the only funding source for that.
Do we have some sort of document in terms of their output, achievements,
Yes.
reports?
They have a strategic plan for what they're achieving their metrics for centers of excellence. In addition, we have performance metrics for them.
Okay, so is there some sort of report somewhere that we can review?
Yeah, would be happy to send you data.
Okay, because they exist, but if they're supposed to be doing this outreach that's happening in community or doing this, I haven't heard that part. And in tough budget years, I'll just say this in case they're listening, everybody's got to prove their worth here in terms of the value. And so in the pre-hearing responses, it shows that the centers have only spent 1.1 million thus far in FY23 of their $12.5 million budget.
Yeah, I should say that the centers were slow in getting started. They went through.
This
an
isn't
entire
year
fiscal-
one though,
I
Dr.
understand.
Farley.
Went through an entire fiscal year where they didn't spend any funding. Then last year they spent about 3 point something, and it's still fairly early in their building of their infrastructure.
And Councilmember, we did cut them. They were reduced, I think 1.697 million. They were part of the 25% NPS cut that we had to contribute as an agency.
No, but it says, what I have is that you all increased the budget by almost 2 million. So I'm trying to understand why.
For the Howard,
For the Howard Centers of Excellence.
so the Howard University Centers of Excellence have to get, I think they allocated 26 million from 2021 to 2026. And they get allocations for every year. And those allocations are set in contract. In FY 2021, they did not spend them. We have a non-lapsing fund that we've created for them as well.
So there's 12.5 million for this year just sitting in a fund?
So there is anything that they don't spend will end up in the non-lapsing fund and available for them for the next year. It was based on that rationale and the level of spending that they had.
Do we get the money back in FY26 if they haven't spent it? Or does
So-
Howard get to keep it?
So
I just need to know if I'm making a donation to Howard University. I like my name on a building, $26 million.
So they have a plan to spend the money through 2026. What we have recognized is that the spending levels that they have do not align with the budget allocations that they were given. And so what we did is we took a reduction of 1.697 million.
But I'm showing an increase.
I don't know. I would need to see that.
Ms. Dean, AFO.
Yeah, I'm showing a decrease as well. I'm not sure what you are.
Okay.
I'm showing a decrease as well. I have the same figure as Mr. Fletcher.
Okay.
I'm not sure what document you are referring to.
Okay.
Reflecting that there was an increase of the 2 million.
Okay. Hold for a second. Okay, so we're showing that it was decreased in ARPA funding, but that local money did not decrease. So let's do this because we're probably not going to resolve this right now. So let's talk about this offline. I think the question that I have is like, how much is in that fund? And then in terms of at least what I'm looking at for a burn rate, even just for FY23, I know they're not going to spend 12.5 million unless they're about to buy a bunch of paper and hire like 30 people in the next 4 months. So let's talk about that.
Absolutely.
All right. Okay. I think Councilmember Gray asked you about the Healthy Start program. He might have asked you about that.
He asked about healthy steps.
Okay. Gotta have some distinction. Every program can't have health in it. I know that's what y'all
I didn't
want.
come up with the names.
All right. So does the proposed budget maintain the FY23 funding levels for Healthy Start?
The Healthy Start program is a federal program and it does maintain that.
Okay.
It does also maintain the local funding for Healthy Steps in case you had that question.
Okay. All right. Let's talk school nurses. Everybody's favorite topic. Okay. So Dr. Lewis, you mentioned that you're in conversations to do something different. Dr. Boudreau kind of hinted at that during her public testimony, and that they will be going on some sort of road show to the schools to sort of discuss. But this is a budget hearing, but there's policy implications. So the proposed budget that we have reduces the Children's Health Services budget by 4.9 million, a reduction of 17%. DC Health reports that this decrease may make it impossible to fully staff all of 178 health suites. So what's the plan here? Now, I understand that in the conversations with Children's, okay, not every school is going to have a school nurse. We're going to go to a cluster model, et cetera, but you still need people, you still need bodies. So how do you all feel confident that the 4.9 reduction can still support even the new model that you guys are proposing?
Yes, and Dr. Farley, if you want to take that and expand more on how we're looking at things differently.
Let me say the CSS has not been able to fully staff nurses even with existing funding because there's the severe nurse shortage, as you know. And so the new model the budget for next year would be sufficient if they didn't hire people as they were in the current year. If they
didn't have to hire nurses.
Right. If it didn't.
We have acknowledged that not every school is going to get a nurse, right? What did y'all do? Med techs or other types of individuals?
School health associates is the term we may be landing on.
Okay, school health associates.
Right.
Does this budget support the ability to hire a combination of school health associates as well as nurses?
Yeah.
For every cluster that you're going to have?
Yeah, so I think that the attempts that we're going to make to try to bring in this new source of staff, we don't know if we're going to be able to still fill all of the positions, although that is our hope. And we know that the salaries would be significantly different than that of a registered nurse. So our plan is to move.
Wait, we're going to reduce the salaries of the people who are already there?
No, I said the salaries would be different than that of a registered nurse. I'm talking about if we bring in additional
Health associates.
Yes, the
Okay.
new health associates, yes.
Yes.
So we're looking at a different salary of I'm just gonna throw it out there, let's say then 100,000, it may be, it's gonna be significantly less than that. So our hope is to be able to at least have these additional individuals to support the remaining health suites that are currently not staffed at the 40 hours a week.
So the 4.9, or sorry, the 23.1 million provides, in your opinion, a cushion for them to be able to hire people less than an RN.
That is correct. We're looking at less than an RN because we have RNs and LPNs. It would be great if they're able to continue to bring on additional RNs and LPNs. I think, but being realistic that we will then be bringing on these other health professionals to support the services.
Okay. So I need to, we're also gonna have to sort of massage this a little bit more, right? Because I have children's telling me, no, this is not enough. If that 4.9, even with our new model, and sure, everybody wants money. Had a whole conversation with Dr. Newman just yesterday,
Yes.
right? They got needs. We all have needs, but I'm just trying to understand how this is gonna work, because at the same time that you guys are gonna be having conversations with schools around like, okay, this is how we're gonna do it new. I want to make sure that if we go in this direction, that on day one, individuals are showing up in the buildings. And so that I won't have school leaders saying, you guys made this big change and I still don't have anybody because the budget was cut and they can't hire folks. So we kind of need to figure this out.
Yes, and I understand. I think that if we were to look at past years, they have not been able to spend fully even what they were allocated. However, this year, as Dr. Farley and his team are looking at things differently to see what we can do to augment the lack of some of the staff in the health suites. So we can continue to have conversation about it and share what projections that we're thinking that it may look like.
Okay. And when will we know, like on paper, what the model is?
Once you can.
Yeah, we'd be happy to meet with you soon, really at your convenience to talk about the model in more depth. It's, it's worth having, I think, a thorough conversation on that.
Okay. All right. We can do that one offline. But while we're talking about nurses, the nurse licensure compact, Dr. Lewis.
Yes.
It comes up in every conversation. So you told Councilmember Gray, we did the regional reciprocity agreement. I knew that. Board of Medicine, talked to the board chair on that front. We have the psych pack, know that. We talked to the board of psychology. Things are going well on that. I understand the reservations about the nurse licensure compact, but I also don't see a way forward here without it to get the nurses that we need. Yes?
So Chairwoman Henderson, I think I have, hopefully will be some good news for you. So let me just tell you what Health Regulation and Licensing Administration is doing. There's two things that are coming forward. So on April the 18th, Erin Gibson has already scheduled a meeting with like members of our 19 professional boards from Maryland and Virginia. And that is to initiate the discussion for all of the professions, actually, to let us see if we can move forward with the regional reciprocity. Of course, we are focusing on the nurse Board of Nursing from Maryland and the Board of Nursing from Virginia, but it includes all of our counterparts from the 19 professional boards. So that meeting will take place on April the 19th. So we can share with you, what happens as a result of that meeting. In addition to that, we have been in close discussion with the DC Hospital Association and of course the Healthcare Association as well. And looking at the nursing compact, I know that you are aware that we did have some reservations because that would mean loss of income to us. And we're, right now we do license over 30,000 RNs. That's just for the RN pool. However, we have already scheduled a meeting with NCSBN, National Council State Boards of Nursing. And that meeting is actually scheduled on April the 20th. And that is to begin discussion on the nursing compact so we can have some dialogue in regards to some of the things that we would be looking at, as well as to further understand how the nursing compact fully operates. So we have two meetings scheduled, two different tracks, if you will. So that's the regional reciprocity and then nursing compact to discuss. Now, one thing I will share is that I know that many of our hospital or healthcare providers are looking forward to us to enter into these compacts. What needs to be understood is that even if you enter into the compact, there still is a significant period of time before it will actually come into full operation, because you still have that IT component to make sure that you have that connection, develop that API. So it's taken a significant period of time, even with the Board of Medicine. I can't remember when we first entered into that compact, but it was, how many years was it, Aisha? 2018, 2019, when we entered into the Board of Medicine compact. And it's really been as of this year that we have the full communication as it pertains to renewals and now to begin with the initials. So it takes a period of time to develop that IT connection. That's why we truly are pushing the regional reciprocity, because that's a lot faster. That took less time for us to actually implement.
Okay.
But we're moving forward. So you've got those two dates, April the 18th.
So we'll check in May.
Okay, and April the 20th.
No, I mean, I think
Yeah,
that's,
seriously.
no, this is good to hear. Obviously, I understand the reservations that you all have, and I'm not minimizing that by any stretch. And in fact, was asking my staff, like, okay, is there something we can layer on, whether it be like a registration or whatever? There is a bit of unease about the idea that someone can practice here and we not even know who they are.
That's correct. Yeah.
But if 37, 38 other states have figured this out, I feel like we have to be able to figure this out. And if nothing else, figure it out with our counterparts in Maryland and Virginia. And so I'm glad to hear that there's some movement on that and that I can report back to my colleagues on that front.
Thank you.
I know that I said that we would take a break, but I only have like 3 more questions.
I'm
So-
good.
Okay, great, wonderful. I haven't seen any of my other colleagues, so we're gonna continue to push through. Okay, let's talk maternal health. It is Black Maternal Health Week, so I felt it was fitting to end here. In your testimony, you described that CHA will be providing all new mothers in the district with free access to the Pacify app to promote breastfeeding. How will DC Health promote this service to make new moms aware?
It's exciting.
Yes, this, for people who don't know, this is an app where moms can get information on breastfeeding, and there's a live person at the other end of the app available 24/7. Because you may need that information at 3 o'clock in the morning.
Sure.
And you need it from the time that you leave the hospital. It's the first 48 hours when you have the greatest need. So, we will have a contract with Pacify to make it available to all moms in the district. We'll make that known to the hospital nursery staff.
Okay.
So, and ask them to promote that information to the moms, and then they could sign up right there while they're in the delivery area.
Great.
Rather after having delivered.
Okay, so this is something we won't roll out until October? Or is
It's-
this FY23?
We're doing it as quickly as possible, and so it may start before October.
Okay. You just let us
You have to get the contract with Pacify in place and get the materials and talk to the hospitals about distributing them.
Okay. What is the timeline for WIC to be added to the DCAS benefits enrollment system?
I'm not sure about WIC being added to the DCAS enrollment system. We are working to matching WIC data with TANF and other program data, and then doing our own outreach to folks who are eligible for WIC but not enrolled.
Yeah, so like DCAS is it's supposed to be, in its theory, a one-stop shop. You go to the website, you enter your information, and they can determine right there if you qualify for Medicaid, TANF, and other benefits and incentives. Our understanding is that WIC is not part of that system, that you have to kind of apply outside of that.
I'd have to get back to you on that.
Okay. So in public testimony, we heard from lots of home visiting advocates that $500,000 had been cut from their grants for FY23, so this current year. But that DC Health had assured them that it would likely be restored. So what's going on here? They said they received a notice from DC Health that their grant was being cut for this fiscal year.
One-time funding.
It was FY23, so it's like today,
Who was the vendor?
Mary Center.
I can answer it, and Keith, feel free to jump in. So there was a reduction in the FY23 grant award to Mary Center for their local home visiting program. They also have grants for federal home visiting programs and some inter-district funds as well. That reduction actually was originally slated for FY22, which was taken as part of a larger cut. We were able to reprogram additional funds in 22, so they didn't see the cut in 22. They did see the cut in FY 23. Separate from that, and that's the main home visiting program. There's a first-time home mother home visiting program that was put in as one-time funding.
Yep,
in FY 23, so
150,000.
that has not been renewed in 24.
Because it was one time.
Correct.
Is that common practice to reduce a grant in the middle of a grant year?
I don't think it was reduced in the middle of a grant year. I'm not.
So I guess, well, I guess I'll take that back because I don't necessarily know what the grant period is, but it seems weird that they would come to us and say our FY23 money is being cut when I know we are in the middle of FY23. So let me ask it in a different way. When did you all, did you do new applications for this program for FY23?
So that the change occurred with the FY23 award. It didn't occur in the middle of the grant year.
Okay, I see. So when you guys provided the FY23 award, it was $500,000 less than what they were awarded in 22?
There wasn't $500,000 less. There was a cut. They lost about $345,000 in local funds, but they also saw an increase in some other sources of funds. So for their main home visiting programs, it was about a $275,000 reduction. That's in the, to put in context with all their home visiting together, it's 1.5 million or something like that. Get the rest of the question.
Okay. Well, during public testimony, we also heard requests for DC Health to increase the grant program by 1.2 million overall, not just, I'm assuming not just them, but the grant program in general, to increase staff salaries and improve retention and recruitment. Did you all consider raising these salaries in the FY24 budget?
You know, we saw the questions in advance. Just to be clear, DC Health does not set salaries for staff, does not cap salaries for staff. We make funding available, and then the grantee determines how that comes up with a budget to meet that. So it's up to the grantee's discretion as to what the salaries are for their staff.
Okay. Got it. So for FY23 awards, was the overall pot of money reduced that was available in FY20 from FY22? Meaning not just one grantee, but like the whole pot. So let's say there was 1.2 million in FY22. Is there 1.2 million in FY23? I was trying to determine, like, was it you had more people who applied this year, and so you granted more, or somebody else scored higher, and so they got a bigger chunk of the money? I'm trying to understand.
Yeah, the entire pot was smaller in FY23 than it was in FY22, but it was larger in FY22 than it was in FY21. They do fluctuate from year to year.
Okay. Okay. Hold, please. Okay, I'll include some more on this in the list of follow-ups because we just want to get clear on what's going on there. But I'm looking, I don't see anybody else here. So let's go over the follow-ups and then we'll wrap this up and everybody can enjoy the rest of their beautiful afternoon. All right. This is more for Carl's benefit than anything else, but we'll send this as an email follow-up as well. Okay, so for Councilmember Gray, he wants to know how many health professionals have used the loan program since it expanded eligibility. We asked for the number of masks left in the OCP inventory. Follow up on what happened to the HOSTA Sex Ed Peer Education Grant Program. How many seniors are covered by the dental program? The strategic plan and performance metrics for the Howard Centers of Excellence, as well as a follow-up on their plan for next year. We'll follow up to get some more information about the school nurse model, and hopefully we can make that happen sooner rather than later. And then in May, an update on your April 19th and April 20th meetings on regional reciprocity and the nursing compact. And then we'll get some more details on home visiting grants. That's all I have. Anything you want to end on, Dr. Lewis?
No, but I do thank you for your support and look forward to continuing working with you. And of course, I'd like to thank the residents of the District of Columbia and the staff of DC Health.
Great. So Dr. Lewis, I want to thank you for providing your testimony and information to the committee, as well as making your staff available. Even though I didn't get to talk to all of you this time, I appreciate you being here. If we have any additional questions, my committee staff will reach out to you all. This concludes today's hearing. If anyone would like to submit testimony, the public record for DC Health will remain open until Monday, April 24th at 5 p.m. You may email your statements to astrange@dccouncil.gov or leave a voicemail at 202-430-6046. Please speak slowly and spell your name for the record, your first and last name if you choose that option. This concludes the FY24 budget oversight hearings for the Committee on Health. Over the next 2 weeks, the committee will carefully review the mayor's proposed budget, as well as the testimony we've heard over the last several weeks from public and government witnesses. Informed by this information, we will develop our committee's budget report, which the committee will mark up on Wednesday, April 26th. I would like to thank the many members of the public who testified before this committee, as well as the government agency staff who prepared testimony and responses for the committee's questions and had meetings with my staff prior to our hearings. Your efforts to ensure that we present the strongest budget proposal possible to enhance the public health and safety of residents in the district is truly appreciated. And the time is now 2:21 and this hearing is adjourned. Thank you, everyone.